Person-centered supports. What really matters. CQL has always been at the forefront of defining quality in services and supports. With each edition of standards, measures, or indicators, CQL has asked and heard from people about the real meaning of quality. Those definitions have changed dramatically over 40 years. We've seen the successes, as well as the often slow pace of change in the reality of most people's lives. CQL is leading again with a clear focus on excellence in person-centered services and supports. Building on our own accomplishments in impacting quality for life for people, we are bringing forward fresh insights and new methods. We are inspired by the quote by Georgia O'Keeffe, "Only by selection, by elimination, by emphasis, do we get at the real meaning of things." With a nod to the Georgia O'Keeffe quotation, we decided to ask the specific question: what really matters in supports and services for people? We sought advice on the trends, issues, concerns, needs, and goals of a wide range of people receiving human services, as well as those of organizations, service providers, public officials, advocates, and workers. We asked questions such as, what is the current thinking about person-centered or person-directed services and supports? Where are the commonalities across different groups? Where are the differences? How do you define quality in person-centered or person-directed services and supports? Who should measure quality and how? What do consumers, families, and/or providers want in terms of a quality measurement system? Over a 12-month period, we sought out the best thinkers and innovators across a wide range of human services to guide our work. We conducted an international Delphi survey, commissioned a literature review from external experts, held listening sessions, focus groups, and discussions with key stakeholders across the country, in Canada, and overseas. We met with self-advocates, in-peer specialists, providers, consultants, and thought leaders. Through these efforts, CQL developed our new definitions and measurements for person-centered excellence. These definitions and measurements were then improved by conducting pilot and field tests in the U.S. and Canada, with organizations providing disability, aging, and/or mental health and substance abuse services and supports. We learned through our What Really Matters initiative that the focus must be on the real meaning of quality in person-centered, self-directed services and supports. Person-centered excellence must be what organizations strive for. The CQL, What Really Matters initiative, utilizing the wide array of input and research, resulted in the development of 8 key factors and 34 success indicators to measure personal quality of life. The 8 key factors are person-centered assessment and discovery, person-centered planning, services and supports, community connection, workforce, governance, quality and accountability, emerging practices in individual budgets. To help organizations measure and improve what really matters to the people they provided service and supports to, CQL developed the Guide to Person-Centered Excellence. This new publication contains best practices for person-centered organizations, organized by the 8 key factors. There are 34 success indicators, each with a narrative explaining why this matters and how to put this into practice. While we are committed to a central set of indicators, we recognize that the fields of aging, mental health, and substance abuse and disability each have their own culture, traditions, language, assumptions, and priorities. Therefore, we have 3 applications of the guide. The 34 success indicators are consistent across all 3 settings, while the narratives are tailored to the specific audience and service setting. CQL encourages organizations to use the guide to assess and improve their person-centered services. The What Really Matters initiative has been inclusive, far-reaching, and focused. We've developed new measures for person-centered excellence, guides for organizations and systems, and new products to help organizations to achieve their goals. We also believe that CQL must offer a clear definition of what it means to be person-centered. Our definition is depicted in this graphic. Each person has a vision for what really matters that flows from a singular life history, a range of experiences and emotions, and unique dreams and goals. Each person must be treated with unconditional acceptance and the support to live his or her own life, to plan, to contribute, to participate, to choose, and to be respected and valued. Please contact CQL for more information on our products and services that can help your organization achieve person-centered excellence.